Today I want to start with our guests and then I'll have my sisters say hi. So, so can our guests please say hi to the people?
Hello, everyone. I'm Joseph Kasaija. I'm a women deliver young leader, and we advocate for gender equality for girls and women, ensuring their well-being across the globe. And I'm from Uganda, and I'm very glad to be here today, and also to share my public health expertise, especially on the topic of family planning, contraception, and young people. I'm also a menstrual hygiene and management trainer, and I work a lot with young people together as well as Minister of Health, Uganda, on working on advancing and lobbying for health policies. And currently, as of today, I'm also working with a team from Women Deliver to work together with Minister of Health so that we can launch and pass the National Adolescent Health Policy, which has been around since 2012, which has been going forward and backward. And specifically this policy, what we're trying to do, we're trying to work with Parliament and Minister of Health so we can lobby buy-ins from other people, and especially bringing on board the Interreligious Council, which has been one of the biggest objection to this policy, as well as to bring everyone on board so that this policy can go forward. The reason why we want this policy to be forward, to be implemented, is that it's helping our fellow adolescents and guiding health workers and community and CSOs on how best they can serve family planning or contraceptives or comprehensive sexual education to girls in order to fight and reduce teenage pregnancy, and as well as unsafe abortions and unintended pregnancies.
I really like people that work in such stuff because I feel like there's so many people that don't want to get into, especially when it comes to being on like the women's side and helping to advocate for their rights and talking about the things that hurt them. It's like they're pretty much like there are minorities in the community and people don't want to bring such issues forward. And I'm so happy that you've taken part in going into such a field and learning more about it and trying to bring awareness to people. And the fact that you're a man gives it even more of like a +1. So kudos to you. So today we want to really just continue with like I don't know how you call it. I don't know if you call it about like sexual kind of health.
Sexual reproductive health and rights.
Thank you. Thank you. Yes, so we want to continue with that topic. So when we come to that, what's one of the main issues when it comes to the sexual health and reproductive? What's one of the issues that come forward that you have with like young adults? Is it STDs? Is it early pregnancies? Is it
So there is a lot of challenges what young people are facing as a challenge, even before the COVID came about. One thing is what we call misinformation. There is a lot of wrong information, both online, through myths and misconceptions that are barring young people from accessing services. So the biggest one is a misinformation. People think no, but most of them they don't know. There are taboos. When you grow up as a girl or as a boy, you can't talk about sex with your parents. Okay.
Definitely.
There's what we call comprehensive sexuality education, certain things that you need to know. I've been working on menstrual hygiene. I've been training girls on how to use pads, using reusable and usable pads, using menstrual cups and all that. But you find most of them are facing challenges because they never get a chance to learn about this. And so this has led into teenage pregnancy. I think you have all realized, like in Uganda, the teenage pregnancy rate is at 25%, meaning every 1 out of 4 girls you see gets unintended pregnancy, the teenage pregnancy, which also leads into maternal mortality. Most of them died because they don't give birth from health facilities, and others they face challenges. They get fistula. I don't know if all of us know fistula because of the challenges which come with giving birth and you're not in hospital. There are also other types of products that you can reuse over and over again. We have what we call the menstrual cups. We have what we call the Be-Free cup, and that one is mainly there's a project that's been implemented in Uganda, especially in the refugee camps, where young girls have been able to access the Be-Free menstrual cup, which is you can use it up to 10 years. So it's a menstrual cup that a girl can use. It's bacteria free. They can use it over and over again because they're looking for sustainable solutions, which are also safe for people to use, especially in resource restricted areas.
That's still nasty, man.
It's like sneezing in a hanky and you wash it.
And using it
not wash it. Yeah.
Okay, so
is there like a higher risk of infection?
Yeah.
Because I can only imagine like reusing something for 10 years. Isn't there like a higher risk of infection like when you wash it or like?
So this specific Be-Free cup I'm talking about, it was designed in a way whereby it is bacteria free. So even if you're in a place and there's no water, if you get a clean cloth, you can just wipe it clean. It is bacteria free. That's the kind of design they made it with. Others are not, but also if at all the reusable pads, what we're talking about is mainly for people in humanitarian settings, people in rural areas who may not have the money like you do to buy pads every month. Sometimes girls not having access to money to buy pads has led them to get men to get them money so they can be able to support themselves, which has also led into teenage pregnancies and unsafe abortions. So we are trying to give alternatives, though they may not, the reusable pads are not good if you're not going to maintain good hygiene, water, you don't have access to water and so. That we encourage you to use the disposables. If you cannot have the disposable pads, then you have to think of getting a menstrual cup. Yeah.
Okay. Going back to the questions, what age do you think kids need to start having like sexual education talk?
Yeah, so that's one of the very interesting topics that has been, for example, in Uganda, we have what we call the Comprehensive Sexuality Education Framework, which was also launched by the First Lady of Uganda, Janet Museveni. It went through, and the Regis Council provoked it and had to bring it back. So we realize these days young people are having sex at a very early age. I've seen young people, I've interacted with young who have begun having sex as early as 8. We have had young girls get pregnant as early as 8 years. So I believe that if at all sexuality education is started, especially in upper primary, it will be more effective. And these are something which has been around. When you're in primary, remember, you used to study about the reproductive system or bad touches, abstinence. You remember those things you study about? That is still preparing you about, the sexuality part of it. And the reason why they will tell you, you don't need sugar daddies and all that, that's still part of the sexuality education. However, most times because of taboos and cultures, we fear to talk about this when you're young. But remember, these young people have access to internet. They're seeing a lot of information. They're seeing a lot of porn. They're doing all that. And most times, if you don't guide them, they end up messing up. The other question I have, how free are you to discuss your sexuality with your parents or your sisters? And
that's a good one. That last one is a good one.
Yeah, that one.
Scale of 1 to 10, Priscilla.
Me?
Can you openly talk about like your sexuality with your parents?
Absolutely not.
Pardon?
Absolutely not.
None? Beverly?
With what?
How free are you on a scale of 1 to 10? And how open are you to talk about your sexuality with your parents or guardian or
Negative 0.000. What?
can you
0.
0 and Lona?
Not even close.
For me, one of my parents it's 0, and then one of them is 100%. Like basic. Oh, my mom, like she's so open with us, and I love it because it she doesn't want us to do like any mistake, you know. So for her, she just talks about it. Whereas my dad, he's just more reserved, and you know how fathers are with their daughters. They don't want to think that, so they just like just don't say anything.
They think about it and then they're like they forget about it type thing.
Yeah.
So
Do you think parents should be open to their children to talk about such issues?
Definitely.
Yes, but
I think I will be with my kids.
Pardon?
Go ahead, Samuel.
I would say yes. I would agree. Parents should be more, invested in their kids. But I feel like with the opposite sex. So anything that has to do with sex, you would talk to your mom about, and the guys will talk to their dads about, because they kind of know, they have the same body stuff that you have. Really open to your parents, and you don't care. You talk to both parents as you please. Hey, I give you props. But there's some people who are just still insecure about saying things. So they kind of just rather go to someone who knows, which is probably a mom or their dad type thing.
Yeah, it's what I always encourage parents. We encourage that relationship between you and a child and the parent. If at all you have an open discussion, open relationship, a positive one, it's always good, to hold that sexuality education at home. But of course, these days things have changed. Parents are always away; they're working. Kids grow up with house helps, or they're in school. So it also becomes a challenge. And the other question is, how free are you to talk about your menstrual hygiene, menstruation with your parent? Can you ever tell like your dad I need money like for pads, or do you ever tell like your mom, do you ever open up?
That's an easy one.
Definitely, honestly.
I can ask my dad, my brother, anyone. I can not anyone, but my dad, my brother, my mom, my sisters, that I can ask them for money, or I can even send them to the store to grab me something if they're already at the store.
You can ask anyone.
And honestly, you shouldn't even be afraid to tell them to go buy that stuff, because at the end of the day, they know, because their girlfriend or their wife, they have all gone through it. So of course they know it. So you shouldn't